Good afternoon, everybody. I'm going to start by giving an update on our cases here in Nova Scotia. The last briefing I was at was on last Wednesday, August 26th. Since then, we've announced 4 new cases and 2 probable cases of COVID-19. So as of today, we have 6 active cases of COVID-19 in the province. Our total numbers so far are 1,085 cases of COVID-19, with 76,935 people who have been tested with negative results, and we have had, unfortunately, 65 deaths. The Nova Scotia Health Authority's lab completed 961 tests yesterday. 2 of the cases of our 6 that were recently reported were in the northern zone and were connected to previously reported cases, close contacts of previous cases in that area. An additional case was identified in Eastern Zone, and that individual, it was related to travel outside of Atlantic Canada, and the individual had been self-isolating as required since their entry into Nova Scotia. The 4th individual was identified in Western Zone, and as was being reported publicly yesterday, the individual is a student at the University St. Anne, and appropriate public health measures have been put in place working with that university. We also announced 2 probable cases of COVID-19 at 2 universities, one in Dalhousie and one at Acadia in Wolfville. Both students are from outside Atlantic Canada. They both live off campus and have been self-isolating as required. So let me talk a little bit about probable cases because those are new to many folks, and it's certainly something we anticipated when we started down the road of testing large numbers of students without symptoms. A probable case means that the test result was, the lab calls it indeterminate, which means that it's not strong. We can't confidently say it's negative or positive, so it's somewhere in the middle. And we fully expect that when you start testing a lot of people without symptoms, we know from experience previously with COVID or with other diseases that we are going to start to get more and more of these indeterminate test results. There are a few reasons why a test result may be classified as indeterminate. If someone has previously had COVID-19, they can still, for weeks afterwards, even though their infection is cleared, they can still have some residual virus in their nose and throat, and we're picking that up with a test. It does not mean that they're still ill. It does not mean they're still infectious, but that residual particles of virus DNA can still be picked up on the lab test, and you can give you an indeterminate result. It could also mean that somebody has been tested very early on in their infection, and they may not have enough virus to give you a full positive result. So again, they could be indeterminate, but it's because they're very early on. We can also have issues around a cross-contamination in the lab potentially, or a cross-reaction from another viral infection that somebody has. So in each of these situations, when we have an indeterminate result, the local public health folks working with the regional medical officers of health, we work closely with first the lab, and then with the individual who's been tested and any other physicians involved to look at their clinical symptoms to try to categorize their indeterminate case. And ultimately, we're looking at a number of factors to say, is this somebody who is either an old case and that we're just picking up well after the fact and we don't have to worry about that anymore? Is it a cross-reaction or cross-contamination that we have just to be aware of more in the lab? Or is it one of these cases which is very early on in a new case? And if it's the latter, if we consider this to be a new case, then we're going to treat it like any other case of COVID-19, require isolation, do contact follow-up, etc. So I think it's important that we understand that people understand this new category of test indeterminates and probables, but to be reassured that public health does the appropriate assessment in each and every case to make the right determination, and we will always err on the side of caution of calling it a new case if we're not certain, and then doing all the measures like we do with any other case of COVID-19. With both our probable cases to date, we used our expertise, and we actually made the determination that there quite possibly could be these very early on cases, and then we took all appropriate steps to isolate them, identify any contacts, etc. But fortunately, both cases had been following the self-isolation rules required for university students, and there hasn't been any broader exposure. So again, we have now identified 1 positive case and 2 probable cases amongst our post-secondary students. That's good news because we are testing hundreds of them, and we fully expected to get some positives. We've gotten 3 so far, so that's a very low percentage of positives. So to me, that's a signal that, and it reinforces why having this testing strategy for post-secondary students coming from outside of Atlantic Canada was absolutely necessary. People need to understand that because of this testing, these 3 individuals, we were able to identify them quickly and manage these cases. But I think it was important that people, especially the post-secondary students, understand that just because we have a testing strategy, that doesn't mean that they can disregard all the other public health measures. In order to keep all our communities safe, that we need to continue to need all the students coming from outside of Atlantic Canada to complete their self-isolation, do their daily digital check-ins, and to follow up with their testing protocols. And if they do, we're reminding the importance of all students to be isolating. If they're not sure of the rules, isolate and ask questions, and wait and stay isolated until you get the answers. So let me move on then to today's major topic, which is our public schools. Last week, I did talk about the public health measures that are being implemented in schools across the province, and then the fact that we have a back-to-school plan that will allow us to strengthen public health measures if necessary. If our COVID-19 activity increases, we certainly have the ability to strengthen the public health measures and continue to have safe spaces in our schools for teachers and students. There certainly continues to be a lot of discussion, and concern, and even some criticism about what will happen in schools if COVID-19 does occur. And I want to make the statement today, and as I made it before, I fully expect we will get cases of COVID-19 in a school. It doesn't mean that the plan has failed. It doesn't mean that there's a crisis. It simply means that what we expected to happen has happened, and then we will respond appropriately. But I think people have an expectation that we're somehow going to have no COVID in schools, and that if there is COVID, that somehow there's been a big failure. That is incorrect. We expect to get COVID. We have plans in place to manage it appropriately. So public health is well prepared to deal with COVID. We have plans in place, and as I said last week, even though this isn't a template or a cookie cutter approach, we will take a very cautious and timely response. And I'm going to lay out some of the framework that we will take in more detail today. But ultimately, the detailed actions will be dictated by the specific circumstances that are occurring in any given school. But let me share with you today some of the information about the key elements that staff, students, and parents can expect in a response to COVID in schools. That response is determined based on answers to a few key questions. So we'll be looking at information on, is the individual who has tested for COVID, are they a student, a staff member, or an essential visitor? Is it a single case, or are there other confirmed cases in the class or the school? What type of exposure or risk to other students, staff, and visitors has occurred in that school? Where did the case likely get infected? A critical question is, with any case, you say, well, when would they have been contagious? When would they have been able to spread the virus to others? And then where were they in the school during that time, and what were their activities while they were potentially infectious? One of those questions is important as how do they get to school? Were they on a school bus? Do they participate in a before or after school program? So that's all the type of questions we use to get the detailed information to basically make a determination on who else might have been exposed to this individual and then be at increased risk for COVID-19. So we basically put people in 3 groups of exposures. So a student or a teacher would be considered at higher risk if they were a close contact of a case. And a close contact is someone who has been in close, so within the 6-foot distance, and prolonged, a minimum of 15 minutes contact with a confirmed case. And we start with the up to 48 hours before that confirmed case became symptoms. So starting with 48 hours before that case became sick, who were they in that close, prolonged contact with, and anybody who they were is then put in determined as a close contact of the case. So for students in cohorted groups in elementary and junior high, this is likely to include all the students and staff within that classroom cohort. For higher grades, the students who are non-cohorted groups, this may include all the students and staff in each of the classes that the case attended. We're also certainly going to look at anyone else who's been in close, prolonged contact with the case outside of their cohort, including things like individuals who they're on a school bus with, if they were in other before or after school programs, family members, friends, other community activities. We consider someone to be at moderate risk if they have not had prolonged contact and they have maintained that minimum of 2-meter distance, but they may still have been in the same classroom or the same program as the case. So, for example, this would include if there are students and staff in a shared space like a classroom who are able to maintain that physical distance of 2 meters at all times from the case. We would call them then a moderate risk of being exposed. And then finally, we have people who would be considered at lower risk if they've only had brief contact with a confirmed case. So this would mean anyone, for instance, who's only had incidental contact. So if the only exposure could have been they were walking past each other through a hallway or another common area for a very brief interaction, that really isn't a significant risk of being exposed. So if that's the only contact somebody had, they would then be put in that lower risk. So as you can appreciate, there's a lot of work for public health to say, where has that person, the case, been? What have they been doing? Who else was in those spaces? And what were the type of interactions that happened? But that's the work that we do every day with all types of other communicable diseases, whether it's measles, whooping cough, et cetera. We do this on a regular basis in a school environment. But it's that assessment we would do. The first step is to say, are people a close contact, a moderate contact, or a low-risk contact? And at this point in time, the approach, the steps that we're going to take with both the higher risk and the moderate risk, we're going to take the same approach. We're going to err on the side of caution and treat moderate and higher risk the same. As we get more experience with this, we may be able to say that we don't have to be as cautious with moderate risk. We'll see what experience we get. But we're starting out, our premise is always to err on the side of caution. So the key components of our response is that as we start to do our investigation, once we identify these close contacts, we arrange testing as quickly as possible for all of those individuals. And then anybody who's deemed to be a close contact and is tested is required to isolate at home while they're waiting for the test results. If their results are negative, then they will need to continue and complete their 14-day isolation period because they have increased risk of being exposed. They have to stay isolated for that full 14-day incubation period before they can come back to school. Individuals who test positive are now themselves a case, and then it creates they then have to isolate because they're a case, and then they generate their own circle of contacts that public health will then investigate. I think it's important that parents understand that there's a possibility that any of their children in school, or teachers, for example, themselves, anybody in a school environment could be in a position where they have to be isolated at home for 14 days before they get a test, and if they test negative, continuing the rest of that 14 days. So teachers and parents and students should now be thinking about having a plan in the possibility that he may be at home for 14 days and how that's going to be managed at home, and keeping people isolated as much as possible at home. Isolation means they're not to be out and about in the community. They basically have to be staying at home and keeping isolated as much as possible, even within the home environment. Public health, we throughout that 14 days, we keep in close contact with those individuals and monitor them in case they do become sick and need further medical and then convert from a contact into a case. The other piece of this is important, that a key piece of our immediate response in a school, if there's a case, will be communication to families and to teachers within that school about the situation that's going on and what the information they need to be aware of, and what steps, how they need to be monitoring their health, and what, if any, other steps they need to be taking. So communication within the school and for families who associated with the school is an important priority for part of our public health response as well. If a student becomes unwell or develops new health symptoms while they're at school, we certainly have plans in place that teachers and administration to recognize that as early as possible, isolate the student away from the rest of the school as quickly as possible, keep them monitored, and then to contact with family members, parents or caregivers, to have them taken home as quickly as possible. It then becomes the responsibility of the family, the parents or caregivers, to then continue to then follow up with 811, doing our message for everybody is that whether themselves or their child becomes unwell or develops new health symptoms, the first step is to isolate. The second step is to do the 811 online assessment, and if you don't have internet access, calling 811 and get further direction around the need for testing based on from the advice from 811. And that's a critically important that people understand that. Today's about schools, but that message is for everybody. If you're unwell, you should stay at home or get home as quickly as possible. Do the 811 assessment. Keeping people who might have COVID away from others, isolated at home until we get an assessment and get them tested as necessary, is a critically important part of how we prevent the spread of COVID in our schools and in our communities. I certainly hope we won't have to close a school, but we need to be realistic, and we're certainly prepared to do that if that's what is required based on the public health assessment in discussion with the school administration. Our foremost priority is to keep students and staff and our other people in the schools as safe as possible. That I need to emphasize that a school will only close due to COVID-19 reasons based on the advice and the recommendation from public health, and that would be we'd close down a whole school only if we felt that there was increased risk to all staff and students. It's much more likely that we're going to be in a situation where we're closing down a classroom because there's a case within a cohort within that classroom. But we are prepared, if necessary. We would take the step, if necessary, to close down a full school. We hope we won't get there, but we are prepared to do that. And let me talk a little bit about immunocompromised students and teachers, because we're getting a lot of questions on them as well. I certainly know that parents who have immunocompromised children and teachers who themselves may be immunocompromised have even more concerns about this school year, and I understand where those concerns are coming from. But there are processes in place to deal with that. Certainly, there's well-established processes for teachers through their human resources in the education system that are in place through the regional centers for education. The IWK Pediatric Advisory Group has been providing direction about who qualifies as immunocompromised. I mean, there are a lot of people who feel they're immunocompromised, but there are very specific medical criteria to who is truly immunocompromised. So it's important that that people are given the right guidance to make an assessment of whether they truly are immunocompromised and therefore at greater risk for COVID-19 versus a feeling that they might be immunocompromised, but really that is not there's no medical facts behind that to really say that they are immunocompromised. So there are specific guidance available that has been made available through the education system for families. It's available for physicians to make that determination of a child whether they truly are immunocompromised. Many of these children are already well known to the education system, and there's a well-established process in place for immunocompromised, maintaining the safety of immunocompromised children in the school system, and what actions may need to be taken if there's a range of infectious diseases, because often it's an infectious disease, whether it's a measles outbreak in a school, whether it's COVID-19, that puts that immunocompromised child at increased risk. So at the end of the day, we will encourage parents who, if their child is immunocompromised, is to have the conversation with their physicians and continue to work with the school system to have specific plans for the individual child. And as I said, the IWK is supporting the education system around those detailed issues around specific children. And if your child is immunocompromised and does need to stay at home, I've certainly been confirmed to me by Minister Churchill and others in the Department of Education that there are processes in place for those children's learning to continue to be supported. I also know that there are teachers, staff, and students who live with immunocompromised adults, and that also creates worry. And certainly no one wants to transmit COVID to a loved one, especially somebody who is at higher risk of complications from the virus. And that, I come back to, that's why it's important that all of us continue to practice public health measures, whether we're in schools, whether we're other workplaces, whether we're out in the community. It's critically important that we all practice our public health measures of keeping physically distanced where possible, wearing masks, hand washing, and minimizing the chance of any of us taking an infectious disease back into our homes. So this will be a school year like one we haven't seen before. That's certainly true. COVID is creating change in every part of our society and communities. But I'm certainly continue to maintain that the best way to protect our schools and everybody in them is to keep community transmission low. That's our focus. We have a very low level of COVID activity in the province. We need to continue to maintain that low level of activity. And how we do that is things like we're doing with university students, the quarantining and the testing, minimizing the chance of introduction of COVID into Nova Scotia, as well as all Nova Scotians continuing to follow the public health directives on physical distancing, gathering numbers and masking, and practicing good hygiene like hand washing and regular cleaning of common surfaces. If we all do that well, we will keep COVID at a very low level, and we will continue to have the ability to have very safe educational environments, whether it's the public schools or our universities. But we have to remember, and hopefully people have been reassured today, that if COVID-19 is identified, public health is positioned to act quickly, to identify and test anyone who may be a close contact, and to minimize the opportunity for COVID to spread further within that school. I just want to take a minute to talk to parents and to ask them, if they haven't already done so, before we get to Tuesday in school, it's important that you talk to your children. Help them understand what will be expected of them at school. Things will be different. Mask wearing is one example. Talk to them about any fears they may have. It's perfectly, and help them understand that it's normal to be fearful, normal to be anxious, that this is a very different situation. So those feelings they have are actually normal. Help them appreciate that those are normal. But then we need to work with them to give them some tools about how they deal with that, and very often giving a sense of control by teaching them about how to wear a mask properly. Focusing on how do they making sure they know how to the importance of the frequency and how to wash their hands properly, helping them understand the importance of physical distancing. Those are all things that gives them control and helps them manage their fear and their natural and normal fear and anxiety. Again, I emphasize my message that it's critically important that families understand that if a child is feeling unwell or develops new health symptoms, they should not go to school. They should stay home, and then an 811 online assessment should be done. That's critically important that we keep kids who may have COVID out of our schools. It's all these steps together, that everybody working together to keep our communities COVID safe. We will also keep our students in school learning and socializing.